Welcome to this explainer. Okay, if you're tossing and turning at night, just staring at the ceiling and feeling that absolutely deep, bone-crushing sense of exhaustion the next day, well, you are absolutely not alone. Today, we're unpacking the proven path to finding real, lasting solutions to your sleep struggles. We're going to break down the latest guidance from top Norwegian health authorities to show you exactly how to take back your nights. Let's get into it.
Okay, let's dive into this. Because when we hit a wall with our sleep, the immediate instinct for so many of us is to just reach for a quick fix, right? Like a pill. And honestly, it's totally understandable. The frustration of not sleeping is literally overwhelming. But we really need to question this common assumption. Is medication actually the ultimate fix? Or is it just kind of masking a deeper issue? Well, let's look at the data.
The sheer scale of this issue is just staggering. According to the Norwegian Directorate of Health, 1 in 3 adults struggles with their sleep on a weekly basis. 1 in 3. That is wild. This isn't just some niche issue. It's a massive, highly underestimated public health challenge in Norway that affects literally everything, from our daily mood to our long-term health. But here is where the numbers get really concerning. While up to 15% of the population suffers from chronic insomnia, a massive 85% of those struggling do not get the treatment they actually need. Notice this massive gap. I mean, we have a huge portion of the population either suffering in total silence or just seeking the wrong kind of help.
And when people do get help, it often looks like this. Over 400,000 Norwegians rely on sleeping pills at any given time. Wow. That is a heavy reality. It essentially tells us that as a society, we are heavily over-relying on a short-term medical crutch instead of, really addressing the root causes of our sleep problems.
So what exactly are we dealing with here? Let's define it. Insomnia isn't just, one bad night. Clinically, it's defined as self-reported problems falling asleep, waking up frequently during the night, waking up way too early, or just having really poor sleep quality several times a week for at least a full month. If you are nodding your head right now because these symptoms sound all too familiar, well, you know exactly how severely this impacts your daily functioning, your focus, and just your overall quality of life.
Section 1. The core comparison. Medication versus natural habits. And this brilliantly illustrates the whole point. If you take away anything from this explainer today, let it be the clear distinction between these two paths. Medical treatment, like sleeping pills, is strictly meant to be a short-term band-aid. It's for acute crises, like a sudden life trauma, and it should really only be used for a maximum of 2 to 3 weeks. On the flip side, non-medical treatment is your long-term foundation. It focuses on highly effective habit changes and cognitive behavioral therapy for insomnia, also known as CBTi. Simply put, one is a temporary band-aid, the other is the actual cure.
But hey, don't just take my word for it. This quote from the Norwegian Directorate of Health firmly busts the myth that sleeping pills are the gold standard. They clearly state, research shows that treatment without medication gives better effects both in the short and long term. That's absolutely crucial. It's authoritative, it's backed by solid data, and it is the current standard of care.
Moving on to Section 2. Simple coping techniques you can start today.
So if pills aren't the answer, what is? Well, it all starts with the fundamentals of cognitive behavioral therapy for insomnia, or CBTi, which, is really just a clinical term for retraining your brain and your daily habits. It involves educating yourself on sleep hygiene, actually challenging those anxious thoughts that keep you awake, and practicing true relaxation techniques. But most importantly, it's about stimulus control. Basically, meaning your bed is strictly for sleep, not for doom scrolling on your phone for hours.
Now, what's really interesting about this approach is this highly effective technique called sleep restriction. I know, it sounds a little intimidating, but it works wonders. Here's the breakdown. Step 1. Keep a sleep diary for a week or 2 to see exactly how much you actually sleep. Step 2. Limit your time in bed to match only that actual sleep time. So if you only actually sleep 5 hours a night, you're only allowed in bed for 5 hours. And step 3, as your sleep quality improves and gets more solid, you gradually increase your time in bed. It essentially forces your body to consolidate sleep and stops all that endless tossing and turning.
Which brings us to Section 3. The patient journey. Getting the right help. Let's move to and see how this builds. Because understanding the techniques is only half the battle, right? Knowing where to go is the other half. So let's look at the correct hierarchy of care in Norway. Step 1 is always at home, keeping that sleep diary we just talked about. Step 2 takes you to your GP or your local municipal Friskliv-sentral, where you can actually get CBTi guidance and take municipal SOVno or Sleep Well courses. Finally, Step 3 is the specialist hospital level. But notice, this is really only for complex cases like sleep apnea. True relief for standard insomnia, that starts at home and right in your local community.
To clarify this even further, hospitals like Oslo University Hospital actually explicitly state that referrals for simple insomnia and circadian rhythm disorders are usually rejected. Why? Well, because diagnosing them doesn't actually require the objective physical sleep tracking equipment that hospitals use. Specialized hospital care is strictly reserved for physical issues like sleep apnea or narcolepsy. So your best help for insomnia is definitely through non-medical therapy with your local health providers.
So, the crucial takeaway here is that the power to fix your sleep largely lies right in your own hands and your own habits, not in a pill bottle. And I want to leave you with this question to really think about. What single sleep habit will you change tonight to sleep better tomorrow? Seriously, start small, be consistent, and reclaim your rest. Thanks so much for joining me on this explainer, and I will see you next time.